long line, people trying to get in here. I mean, you could see this. You still have a couple open seats.
Right. Get reservations,
What's the matter? No, that's not good.
Okay, Charlie, we're in the midst of starting. Take your time there.
Thank you.
Welcome. Okay, welcome everyone to the July 17th, 2023 meeting of the Yarmouth Board of Health. I'm Hillard Bosky, the chair, and just one item here for business, that this is a hybrid participation meeting such that you can be here participating or at another location via Zoom. And if someone wants to join the meeting, you need to go to the website zoom.us, click on Join a Meeting, and enter the meeting ID. And that number is 871-1526-3955. Once again, the meeting ID is 871-1526-3955. Okay, first thing we're going to do is some attendance. Mary, are you present?
Present.
Charlie? Eric?
Present.
Okay, we can move forward. That's great. All right, the first item, as usual, is the public comment. If there's someone in the audience or at home would like to come forward and address the board. Questions, comments?
Sure.
From the public?
Yes.
Not yet. We're just going to see if there's anybody from the general public. You could have a seat, come on. If you want. As usual, we're just waiting for everyone to ask questions and address the board. It looks like we're almost done with public comment. Okay. So we thought we'd go right to one of the updates. Why don't we do that? And that's number 3. We're going to be jumping around here a little, everyone.
Yep.
And there's a rumor out, there's a new assistant health director.
The rumor's true. Mr. Chairman, if
I don't know if that's valid or not. Perhaps you can address the issue at this
Sure.
point.
Mr. Chairman, to the board, if I could, over the past 2 months, the Board of Health, through HR and the town administrator, have advertised and received a number of applicants for the position of Assistant Director of Public Health in Yarmouth, and through a series of interviews, we're pleased to announce that Mr. Barry Lewis, the present health agent in the town of Dennis, has been chosen, selected, and his start date will be the end of this month, the 29th, is it, of July? I believe that Monday of July. So in several weeks, he will come on as the assistant director in Yarmouth.
That's great.
Thank you. It's an opportunity to meet him and present to you a little bit of his experience, and for the board to ask questions of Mr. Lewis.
Welcome. The
Thank you
floor
very
is
much,
yours.
board. Barry Lewis. I am a health agent in the town of Dennis for the last 4.5 years. I am a resident of Yarmouth for the last 17 and a half years. So I'm glad I don't have to make that long trip all the way across the Bass River Bridge. So absolutely enjoy what I do, and I'm very much looking forward to coming to be part of the Yarmouth team here. So
Maybe just explain a little bit of your responsibilities you have in Dennis, so they have a sense of your reach and breadth, what your past experience and where you are now.
in my previous life, hospitality and tourism background, lots of restaurants and hotels. So I was brought on to the Dennis Health Department as their restaurant, hotel, pool inspector. Due changes, I've grown. I've done a lot more of the Title V septic inspections, plan reviews, building reviews. Currently Title V septic inspector. I am also just got accepted to do my soil evaluators class for my Title V courses. I'm very confident in what I do, and once again, I look forward to being part of the Yarmouth team.
Okay. Anybody have any questions?
Hello, Charlie. I didn't didn't get to say hi to you before, so I'll come shake your hand in a minute. Oh, Eric.
Well, okay, I can just, Eric, you're
Yes.
smiling. That's good.
I had the opportunity to meet Mr. Lewis at Cape Cod Tech a few months ago, so welcome aboard. It's good to see you again.
Yes, sir. Thank you. I told you I was going to come aboard one day.
Yeah, you sure did.
Yes. Thank you.
If you ever need anything, just, give us a call, whatever, any of us, all right? If you have any issues. After 4 a.m., it goes this way, okay? That's it. Okay, fair enough?
Okay.
Okay, good. Certainly an emergency, it's any hour.
Yes, sir.
Something comes
Thank
up,
you.
and I'm serious about that part of it, okay?
Appreciate that.
And I know you have something scheduled for this evening you need to get to, so.
You don't mind? Thank you.
you know,
I will see you in 2 weeks from today.
Good.
I'll be
Barry, thanks. And again, I think
running.
the chairman mentioned it earlier, very informally, we want to have a very strong working relationship. So tonight, you're the last time you'll be called Mr. Lewis. You're Barry. Welcome aboard, and we're thrilled to have you here in Yarmouth.
very much. I'm
So
excited,
thanks so much.
too.
Appreciate it.
Cheers.
Thanks.
Thank you.
Look forward to it.
Thank you.
Okay. Right now, we're going to actually skip to one item under new business. Okay, we're going to do that. Okay.
See ya.
We have a new applicant for the Board of Health. There's a Dr. Lawrence Venezia who's here this evening. And it's always great to have some interest from the public about the Board of Health and joining. Dr. Venezia, why don't you come on up, have a seat. And we had some information about you just from an application. One thing I know, you've probably been the doctor for about 37% of the dogs in Yarmouth. I understand that's probably the number you're at this point. We'd just like to kind of know a little bit about yourself and your interests in what issues in health, or whatever.
Yeah, so I'm retired. I retired, be 2 years in October. Took me about a year to get used to it, but I'm sort of settled into retirement now. So I thought that I might be able to offer some input, from a veterinary perspective to the Board of Health, and at the same time, appreciate what you as a board does for the town, and thought might be, I could contribute at the same time. Feel like I would benefit personally from being part of the organization. I've had a little bit of experience with the Board of Health, and it's been a positive experience, and I think I'd like to help, see if I could contribute, some of my experience and education to the Board of Health.
I know recently you came forward and it was very helpful and constructive in one of the issues we were struggling with here recently.
I was
so.
impressed by the way the board handled that situation, that, I felt like, it was a positive experience for me.
Thank you.
Yeah.
Board members, any questions, comments?
Do you have any volunteer experience?
I don't. Well, volunteer in an organizational way. Well,
kind of volunteer?
yacht club volunteering. Yeah, I think that's probably the extent of it. Yeah, I'm no longer a member of a yacht club, but, I have a sailboat, and spend time with that, and I have a motorcycle, spend some time with that, do a lot of gardening, and, I have a real interest in wildlife, I work with that, and so but I really don't have any experience volunteering to an organization in a formal way.
And you're a year-round resident, is that correct?
I've been a year-round resident for over 30 years in Yarmouth. Of course, at the Hyannis Animal Hospital, we built that clinic back in '95. We moved up the road from Willow Street, from Hyannis into Yarmouth at that time. And I think we went through the Board of Health, through the Planning Board, to get that building constructed at the time. I no longer have any affiliation with Hyannis Animal Hospital. I sold the practice, November 2020. I planned on working there, but I decided after there was sort of a thesis change from when I started the practice, and I felt like it was time for me to retire.
Yeah, training is different sometimes, or how the practices run, and things do change in healthcare.
Yeah.
Were we in the process of selecting an individual for the board?
So at the last meeting, if you remember, there was another candidate came forward, Miss Barbara Potts was her name. So the board would, doesn't have to be tonight, would set forward a recommendation. The recommendation will go to the selectmen, and the selectmen would be the appointing authority in that. But that, I would hope that the board could put forward over the next week or soon, a shorter time frame, to be able to put that in front of the selectmen so that we can fill out the board. That would be great, because it's been several months now that there's been a vacancy, and it would be good if we could have that, so.
Yeah, I think there's been plenty of time at this point where people had the opportunity if they're interested.
There has been time.
You understand that we have dealt with animals, and we do some, but it's not the majority of the work of the board. I mean, you have to learn about septic systems and fun stuff like that.
Well, I fully understand that. There's probably a lot of zoonotic issues that I might be able to contribute, some experience. I've had certainly over the years, a lot of experience with vaccination protocols. So, I mean, I do have a scientific background that I think would be useful to the board.
And you're willing to learn new things, too.
Oh, absolutely. Yeah, absolutely. And that's part of the reason I like to take it on as a challenge.
Right.
If I could just add, just to answer your question, I saw your background and saw your resume. To answer your question, you thought perhaps you could add some value. Without question, you could add value. And see, I know what comes across my desk as recent as today, as the Director of Public Health. We had several animal issues, dogs. MSPCA stepped in, but to have that resource, and as Mary mentioned, it isn't all the time. But when it does come up, I don't have a resource, an expertise to go to on that. So you stepped in on an issue with horses. There are multiple stalls and licensed stalls that are permits that we issue. To have that expertise to call upon would be extremely helpful, Doc. So please know that you're stepping forward in a time and adding to a skill set and an expertise that the board has varied. It's a varied skill set to include Eric, who's joining us remotely. It fills it out very nicely. So appreciate that you'd step forward and add value to the board.
Yes.
It's clearly their decision, but I know the issues that come before the office down. You'll see it at some point down the end of the hall, and to be able to pick up the phone, which I do to the board members, it'd be extremely helpful.
Absolutely.
I'd be happy to help any way I could in that respect.
Thanks.
That's great. All right, everyone, anything, Charlie? Okay, I mean, one of the good news would be you don't have to sit here for the whole meeting.
Good. Okay, well, at least this one.
I'm sure you'll be at home on Zoom, of course, taking notes, of course.
Don't.
Thanks for coming in.
Yeah.
Thank you very much.
You bet.
That's terrific.
Hey, Dr. Venezia, take care.
Thanks for the time. Thanks for the invitation to come in.
So appreciate it. So appreciate it.
Okay, so we're going to skip any more new business at this point, and we're going on to number 2 you'll see on your agenda, which is a discussion, and this is the Eversource Energy 5-year Vegetation Management Plan. And I think Carl's here tonight, which he certainly has done previously, to bring us up to date where we are.
Heaven for Carl. I
Yeah.
have to read that voluminous email that you sent us. 'Cause,
I didn't want to print that.
no, didn't want you to even have to send it, so.
Hello, everyone. The board received some enclosures on the topic, the Eversource Vegetation Management Plan for electric power lines. And this plan, the board reviewed in November. But we since received notice there's been revisions made to the plan. So I scanned the plan and the processes looked the same to me. So I contacted both the Eversource arborists listed on the notice and also the Massachusetts Department of Agriculture pesticide inspector who's listed on the notice. I had the opportunity to speak to each. And they both confirmed that the revisions, while there's quite a few, are minor in nature. It's mainly grammatical, organizational, clarification type of revisions. So the essence of the plan, the same practices remain the same. But two items I thought the board would be interested in is some new information. First of all, I get to speak, as I mentioned, to the Mass Department of Agriculture pesticide inspector, who's assigned to right-of-way issues. And he mentioned that during the pesticide application periods, he spends a number of days here on the Cape, in the field, with the pesticide application crews, making observations. Are they applying the pesticide in the manner that's consistent with the regulation? Are they obeying the wind speed restrictions? And he has his own anemometer, and he measures the wind speed, and so he does check on these things. This year, he won't be in the field on the Cape very much because there's only one town on the Cape that will receive pesticides this year, and that's Bourne. None in Yarmouth are planned. So the 5-year vegetation management plan that we're discussing tonight, that's the broad process type of plan. The companion document during the years we have applications is the YOP, the Yearly Operational Plan. And this year, there is no yearly operational plan for Yarmouth because no power lines in Yarmouth will receive pesticides. So that's one thing we won't need to look into this year. And the one other thing I looked into is in the past, the letter the board has directed me to submit, the comment letter, has always included a request for Eversource to respond in writing to each of the board's concerns. And we've never received a response. So what I did is I reached out directly to the Eversource Community Relations Specialist via email, and I included an email in your packets, just to ask her if we may expect a response at some point, because when she was new to the position in the spring of '21, I did speak with her briefly on the phone, and I mentioned to her what we were looking for, and that the railroad pesticide applicator did respond in writing, and I said that was very helpful, so we're looking for something similar. She did indicate an interest in doing that, but she was new to the job. She had to kind of explore multiple channels, so I just thought it was a good time to contact her again and let her know that there has been no response, but the board's still interested in receiving one. So I had no response from her yet, but I only emailed her late last week. So I imagine a large company, she probably has to work through some channels. So if I don't have anything, I'll see if I can get an update from her again. So that's everything I have on this topic.
Is there anything else that you need to do? You said you were going to contact that person again. Anything else?
I'll just follow up with her if I don't hear, within a week or so. I'll follow up with her again. But we don't have any more comments to submit because the plan hasn't changed. They haven't opened a new comment period.
Right.
And there's no application in Yarmouth this year.
Right, that's the
Now,
big.
if that changed, if Eversource for some reason needed to apply pesticide this year, they would have to issue a yearly operational plan first, the YOP. The Board of Health would get a copy of that. So that is what would prompt us to review the topic again and issue a comment letter if you so desire.
So there'd be a window of time that we could do that if they needed to come onto the Cape.
It is when we receive notice of the plan availability, it includes an official comment period. So you know what kind of deadline you have, but it doesn't look like that'll happen this year. So my only other item at this time is just to follow up with the Eversource Community Relations Specialist if I don't hear from her in the near future.
That'd be great. Board members, questions?
Just tell her that we think that's part of community relations, is to respond to our request for a response.
Okay.
Yeah, because we have to answer to the community.
I can certainly do that.
Okay, so we'll skip addressing the issue of having the goats come this year. Okay.
All right. Anything else I can help?
As usual, your presentations are always complete
Thank you. I appreciate that.
and something, in a way we can understand what you're talking about also is nice.
Thank you. My pleasure.
Okay, be well.
Okay, thank you. Take care, everyone.
Carl.
Okay, we're up to number 4 on the agenda there, and this is an update on Yarmouth Water Department drinking water problem corrected notice. That's what I have here. I think we need some help on this. What's up?
Sure. So thank you, Mr. Chairman. I wanted to bring to the community's the board's attention and the greater community's attention that a notice did go out about 10 days ago.
To whom?
So there were certain sections, this is issued by DPW, so I don't know how wide the mailing was.
Hadn't seen it.
Yeah,
so
I
there
hadn't
wasn't-
gotten it either. I found out by a community member.
Yeah, I had somebody ask me about what's going on with the,
Yes. So I'm not sure how wide what the geofence was as far as the mailing. Maybe those just, it all involves well number 7, North Main Street, okay? But a notice went out of the drinking water, and it wasn't an emergency, it wasn't a boil order, but to say that in fact that the raw sample collected on the 5th from well number 7 at 373 North Main Street, the treated sample, it was a routine sample, but it tested, they talked about only the untreated sample tested positive for E. coli. Now, they tested it again. It requires a second test, and it followed up with a drinking water problem corrected. They think it might have been a testing error. So it really wasn't any kind of a boil order, but they're required, this is again DPW, but it's also a public health issue, and I thought the board should be aware. The good news is it was corrected immediately, and immediately following, a correction order was sent out. So the public was never at risk. There was not E. coli in the water, and there was no boil order of any kind. But the other part that the chairman had brought up is to making sure that we have a clear line of a communication for myself and then ultimately to the board, that should there be something, you're notified immediately.
thing, because we do get questions and comments, and it's kind of embarrassing when you haven't heard anything.
Not aware of it, exactly. And I hadn't been made aware of this either, no. So we've cleared up that line of communication so that,
Right.
so just kind of an information only at that point, where there wasn't any alarm or any information, nothing had to go onto the website. But Eric has put up the notice that went out, and then the corrective order. Do we have the corrective order on there also? So
We
that,
have it on the bottom.
yeah, and they may be able to see that immediately a corrected measure was put out to certainly lessen any alarm or concern. Individuals who may be compromised or young children, is there E. coli? That was never the case. Right.
The notice is a vast improvement for what was sent out a year or so ago. So I was pleased to see how well this was done.
Right. I am going to ask, though, what was the scope of the mailing? Because I did not receive it, and it sounds, Charlie, might you have received it? No, you weren't aware either? No.
I didn't receive it either.
No.
Okay. So I can find it, and again, what that service area, like I said, that geofence might have been, but I can find that out. And more importantly, and ultimately,
Ask that we're always copied.
always notified immediately
Right.
to the board.
Help them,
It's a good messaging
public down, and
channel. Yeah.
make them understand what's going on.
Yeah, so perhaps you can find out for us, and probably for yourself, if there is indeed an emergency, how is the communication process taken care of? What happens when people should not be drinking the water and need to be boiling and so on? how is that conducted? That would be helpful to know in a true emergency.
So the communication channels and messaging, should there be a disruption in the water supply?
Yeah,
Yep,
that'd be
I
great.
can find that out. And I'll report that back at the next meeting. But to be clear for the community listening at home, or maybe rerunning this, there was no concern, to be clear. There was a notice of cautionary, and it was immediately corrected, so that
great.
the Yarmouth water was potable and met the FDA standards at all times.
Okay, rep number 5, this is a discussion, and it's simple regulation restricting the sale of tobacco and vape products. Jay, I think it's you again.
Well, sure. What I included in your pack, and I didn't put this in for a vote or any decision, but I do think what I'd like to do is at least to put this in front of the board. The board has adopted the penalty phase of the state regulations, right? The 1,000, and at your last meeting, you had to exercise, and you did exercise the new state regulations regarding a sale to minors. And unfortunately, we had 2 tobacco permit, the vendors, establishments that were caught selling to minors through the compliance checks. And so you certainly are administering and adhering to that, to these regulations. But there are other state regulations that are not included. So I want to put this in front of you so that you could at least be aware, and there are quite a few, they're highlighted in yellow, of what are new and maybe to the state. And what I'd like to ask at the next meeting is for Bob Collette to come in and talk to the board about what that would look like as far as trying to bring the Yarmouth regulation in close alignment and perhaps mirroring the state regulations.
Basically, I don't think I'd have a problem with our doing that, but this seems to rework some of our cap. And I know that when we discussed this, we specifically said that we didn't want the health department to have to get involved with the sale and/or transfer of tobacco licenses. But this puts the onus on the health department.
It does.
So that was the one, thing that stood out to me that was different from what, the state, I guess, is proposing.
Previous. So again, it's not, we could have a hybrid here. We don't have to adopt everything that the state has. There may be pieces. I thought it was time, especially, it had been several years since these state regulations getting in line with the penalty phase.
Right.
But now there are other provisions. Mary, you point out one, they say, maybe that wouldn't be part of Yarmouth's local regulation. But if, at least, and obviously you have to read through this and give you some time to look through to say, okay, here's some questions, and then to have Bob Collette come back in, probably the next meeting, or certainly by the fall, to come in, September meeting, and see if we can tighten up our regulations to be closer aligned with the state.
I have no problem with that.
That'd be great. It gets confusing for the vendors, probably for the board as well.
Right.
Yeah.
Okay.
It'd be nice to know if other towns are doing that too. Because that's something that our retail establishment owners are always worrying about, concerned about, that we're doing this and nobody else is, so they're just going to go over to the next
Yep.
town. So it'd be nice to know.
Yeah, it's interesting, Mary, just Barry, one of previous presenters, works in a neighboring community, and the Board of Health has no authority of tobacco regulations, so it has to be handled by the selectmen, a different authority where,
Like
that's such a health issue, exactly. I mean, it's a board, it's a health issue, and it's important that the Board of Health does weigh in and does exercise that, but it isn't done unilaterally, universally across all communities. I think Yarmouth has chosen the right approach, that the Board of Health is the one messaging, enforcing, and communicating that information.
But it would be interesting then if their select board has adopted the state regulations,
I can ask
what they are.
Bob,
Yeah, he should.
across and typically, I don't know if you've seen in the past, the map of where the community municipalities, where they are in alignment.
Right.
I think his big effort over the past probably 3 to 5 months has been to align the penalty phase of that. And that was achieved here several months ago. But there are other measures. I thought the board should be aware of it, look through it, if you would, have some questions, jot down some things, and then Bob can come in, and then over a bit, there would then be a vote for the board to adopt or to amend the Yarmouth tobacco regulations. But you bring up a good point about the cap and who is that
Well,
executing
yeah,
authority.
And it also wasn't clear to me, the list, I mean, it just wasn't clear whether people could go on a list and then the health department was supposed to know that there was a license available. And, you know, we had said, but then it also talks about retiring, if somebody retiring a license or withdrawing it. It just wasn't clear, and it definitely was differing from what we had, so.
Right. And then to the, when the board does decide what this is, strongly communicating this, because we took the time, when the board decided to change the penalty, we actually went out and we met with each of, there's only 29 of them, but we met with each of them, and we had them sign to say that they are aware, because you can easily say, you know, they can come before us and say, geez, well, you spoke to a manager, or one of my, that message never came to me. Messaging, that's the measure of success, of how well you communicate it.
And that was a huge difference in terms of the fine.
Right. To go from 300 to 1,000,
Yeah.
2,000, yeah. At the last meeting, two establishments were levied a $2,000 fine and a 7-day suspension.
That's really,
One other issue to keep in mind is that when there are new products or new nicotine products, sometimes, I mean, Yarmouth was pretty progressive, the board was, in addressing some of those things when they became new topics.
Right.
In sales of tobacco, where we may not want to be aligned with the state necessarily. There could be some differences, just
Right.
keep that in mind.
This is called out in several sections. There are some areas where they talk about some of the flavor, the mint, the menthol.
it seems like it covers it pretty well, but in addition, they require the retailers to have a letter from the distributors talking about the amount of nicotine in the products, as well as whether there's any flavor enhancers. And that's one of the reasons I'd be interested in who else has adopted this, to know if the retailers are going to have any difficulty getting that from the distributors. Because that's saying they have to have it, so in other words, when, you know, Phil goes out and inspects, that's something that he would be looking for. You know, where's your letter from the distributors saying which products are?
By history, that's been a big problem.
Yes.
You're absolutely right.
Yeah,
And the tobacco companies are creative.
sure,
That's,
they don't want to do that, yeah.
And that's why things, you can expect there will be new products or ways to sell the products.
Right.
That's all.
But in this, so as Bob prepares for his presentation, what other communities have adopted?
Yeah, and what has their experience been with their retailers getting those letters from the distributors, giving the nicotine amount and the flavor enhancers?
Okay. Very good. Anyone else?
I'm good. Eric, Charlie, anything? No?
So,
Okay. Looks like we're on a roll here. I'm looking at you here, and we go, number 6 is discussion associate board members, DY students. What's up?
So here, we're going to move to, believe it or not, and I know the kids don't, if anyone listening, and parents probably don't, maybe they do or don't, I'm not sure. But we're going to be moving to a school pretty soon. I put the idea at the close of the last meeting. I'd like to move forward, if the board would like me to, and to give some thought, and I just put associate member, some youthful representation onto the board. And if you feel like that has some legs and some, I would start to put together a format, a framework for what that would look like, the responsibilities. I'd like to reach out to the school department, the superintendent, or they may put me in touch with a principal, or and not necessarily names right now, but what the responsibilities would be. It would be for a 3-month term, or whatever that might be. And I think it would be really unique, and I think the board would be surprised at what you might hear from some of the students. So if the board, I guess it doesn't have to be a formal vote, but if just kind of, if you feel like, or you have some suggestions, send them to me. But if you'd like me to move forward to putting a framework together to have and I just as a working title, I'll call them associate members, or they're not certainly voting members by any means, but to put some participation from high school students to the board. Advisory, yeah, something of that nature. I don't, I'd like to start that so that in September, or the fall anyway, we could maybe be introducing some students. I would anticipate 2. Ideally, I would like a male and a female, and maybe who have some motivation to work in either medicine or public health. Yeah.
Eric, do you want to work with kids at night, too?
Oh, I don't know. I think it's a great idea, though, Jay.
Okay.
Yeah.
Well, thank you.
I do, too.
Yeah.
Yep, I like
So,
it.
so I'm going to put some things together. Before the next meeting, I will probably have already had some meetings with the school department, and I'll let you know how that progresses,
Right.
if that works.
Okay.
Okay, Herc?
Absolutely.
Terrific. Great.
Okay, coronavirus updates, and this may be at the point where we're going to have a change of that. Right now, things are looking pretty good along the pandemic front. And certainly, I don't think, and I don't know how other people feel, whether or not we need the full updates or only if something does arise, which it could easily. So I guess it would be nice to just hear from the board. What do you think we ought to do about this, or how to move forward?
I'd like to continue to hear the positivity rate and if there's been any movement in the vaccination rate, but that's all I care about.
Okay.
So if nothing's happened, I don't need to hear it again, the vaccination rates anyway. Oh, and certainly if something comes up, I mean, if there's another strain that comes up out there and, poses a problem, then
Right.
something I'd like to know about, what's happening here in terms of it.
I'm going to, the information isn't as readily available anymore, so this is the first time for the board, well, it certainly predates me, my time here, in 2.5 years, that you haven't had a corona or a COVID update. The blue screen comes up and you see the charts and the longitudinal kind of across the months. That's not available, but I could get positivity and vaccination rates. You want us to see what that would look like?
Just positivity rate, because that changes, but the vaccination rates haven't really changed. So if they change, I'd like to know. I mean,
Right.
obviously, they're not going to go down, but if they go up, it'd be nice to know, that.
And so the board is aware, still up on our website, on our health department website, we have where individuals can get vaccinations. That information is still readily available on our website.
Yes.
So that's being dispensed or distributed, available for the
And where they
community.
could get tested if they wanted to?
Where they can get tested. Right.
Okay, that-
Yes, that's still available.
Fine.
Okay.
Yep.
Eric, Charlie, anything else on that? Okay.
Nope.
All right, we're on to approval of minutes. This is for the April 3rd meeting. These were written really well, I thought. So, some discussion on that? Any comments, Eric, on minutes? Anything? Any
I
edits?
thought I had a note. This was hold on. My papers are
April 3rd meeting.
Third.
April 3rd, okay. April 3rd, under item number 5, old and new business. I'm just going to read it. Chairman Hillard Bosky, the governor extended remote meetings until the end of March 2023 by signing a bill. I think that's supposed to be 2025.
It's not
Right.
2023, yeah, that's right.
So that's the only thing I have.
Okay, thank you. So we can find out whether it's.
It was a
24,
2-year, it's a 2-year extension,
Yeah,
so.
good catch.
Yeah.
Yeah, that's tremendous. Okay,
This is, Eric, this is what happens when you go into the school system
Yeah.
and looking and grading on papers.
I have my red pen out.
I'm not saying after school, though. All right.
Thank
So,
you, Eric.
You're welcome.
Anybody want to make a motion here to approve the minutes?
I move to approve the minutes with the one correction.
Second, anyone?
Second?
Charlie, thank you. Any discussion? See, there's none. Just all in favor, raise your hand. If you're in favor, say aye.
Aye.
Okay,
Aye.
that passes. Very good. We can continue back to new business. I believe there is some, and if there's any old business as well.
Right. There are several. First of all, before we move to that, I just want to say, Erica, thank you on the minutes. You do a great job on that, and that's not easy to do. So thank you on the minutes.
Absolutely.
We so appreciate that. There are several things on new business. July 7th, this community has been faced with, at the spring town meeting, April 25th, I believe it was, with the comprehensive wastewater treatment, the vote to move forward, over $200 million. And a big part of that discussion was, in fact, the DEP regulations, this threat to IA system, and what is that going to look like? Individuals having to put in an IA system. Well, on July 7th, what was draft regulations have been enacted. So you have the regulations for DEP, and what we talked about, the IA system, had Yarmouth not moved forward with the comprehensive system, it isn't 5 years, but within 7 years now is what the regulations talk. Each homeowner would be putting in an IA system. So that veiled threat at the time, it moved the community forward to put forward not veiled threat, it's actually very difficult. These regulations are now in place. And it moved the community towards, I think it was a tremendous opportunity with comprehensive wastewater, and the town administrator, the selectmen, a whole DPW, Jeff Colby and others. Great job in moving. The board took the bold step of putting mandatory advisory, the connection policy in place even before this passed. But those regulations that we talked about, that actually have been enacted in July 7th, and I'm getting phone calls on that. Realtors are asking. People are asking, does that apply to Yarmouth? Well, actually, now that was passed, the consultants will be putting in for the watershed treatment plant, and everyone in Yarmouth is exempt from these regulations because a comprehensive system is being put into place. Congratulations to the town on that. Yeah. Tremendous, tremendous. That was a bold step, and I know it took, that was a long time in moving forward, but a wastewater permit, which will be applied for, like I said, by the consultants that have been hired, homeowners are not required to put the expensive IA systems in, which maybe in a short amount of time say, well, those need to be improved upon. We're going to remove the nitrogen level to 0 on those nitrogen-sensitive areas. So I just want to make the board aware and the community aware that those draft regulations have been put in place. And are we still in new business?
Yes.
We can. I gave the board, Eric, I apologize, I just got them today. I'm going to get them to you. You have traditionally, I don't know how long it's gone on, but you have funded social service agencies, nonprofit agencies, to the tune of $60,000 over the 10, 11 nonprofits here, and they're listed out here for you with the dollar amount, and they all do great work in different disciplines across the community, from the food pantry to Duffy, Independence House, a whole bunch of capabilities, a whole host. I don't need to go through them all. You're very familiar, far more familiar than I, but to the tune of $60,000 is divided. The budget allowed by the Finance Committee and the Selectmen has given $70,000. So it doesn't have to be divided now. It doesn't. You may have a new agency that you think you might be worthwhile. You may want to just wait and see what that $10,000, and you feel like they're funded adequately now. There is an additional $10,000 available for HHS funding, or just to hold right now.
Have you asked for proposals from these agencies, asking for how much they want?
So there is a contract that goes out at the $60,000. We didn't expect to have the 10.
Right.
They're funded, contracts are being written now. We've reached out, and we're waiting for that back, but to be funded at the number that you'll see below that, there is a
That's what
predetermined.
they're getting now.
That's what they're getting now.
But traditionally, we get what they would like to get and why. In other words, they'd like, thank you so much for the $3,000. Next year, we're asking for $5,000 because we're going to implement this specific.
So, okay, well, I haven't seen that, but the ask is out. We haven't received them back yet. So
okay.
that was July 1st.
Okay,
So
so you
we
did-
haven't received them back yet.
Did ask them what they would.
We're waiting for that contract
We
back.
can't always do it at all.
Sometimes you can.
But still, it gives us an idea of
Right.
what kind of need is there that we might be able to help with.
Right. I guess the point, I want to make the board aware that there is an upward adjustment in the funding for HHS funding of
Nice.
$10,000. That's from the town administrator to the finance committee to the board of selectmen, additional funds have been made available. And that speaks to the commitment to the human service, social service agencies that are doing good work, because it's still out, the need still outpaces the funding, really.
Yes. Oh, gosh, yeah.
We could put this on the agenda for October, let's say, pick out one of the meetings and get an update, which the organizations have given you the information. the
That's a great suggestion, only because by then, certainly, maybe not the next meeting, I will have heard back by everyone by then, and we won't sign them until the board decides what the level of funding, how you want to adjust that, or adjust it at all. Maybe you want to keep it level funded,
Right,
but you can let me know.
great.
Okay.
Additional new business or old business?
It was DEP, or rather, yeah, the DEP regulations and the HHS funding for 23-24. And I think that's all I have for the board.
Charlie, anything? Eric, Mary?
Nope.
I don't have anything. So we can make a motion to adjourn, believe it or not.
Do
Well,
we want to
next-
set
next
set a
meeting?
date?
Next meeting,
Okay.
you want to have one? Another one? Should we get together again? Yes.
I'm open for suggestions.
Do you have the calendar there? What would be, is the board comfortable with the middle of August, or another, or do you want to go in 2 weeks, or do you want to, I don't have anything.
August is fine if you don't have something.
Middle of August?
Yeah.
I can certainly call that, but there isn't, we'll be calling a meeting, and there's no sense.
Right. I mean, if you have to have one, we can always
Right.
entertain that, but.
What would be the third week in August?
14th would be the Monday night, would be the
14th?
third week.
Could-
14 is the second.
The second? We have the first and the third available for this room.
For the 14th.
Because,
Is that-
Oh, no, the
first- the fir-
21st.
yeah,
Yeah,
because actually it looks like the 1st of August is actually Tuesday.
right, so the 21st.
So
That
about
sounds
1
good.
month. The 21st, is the board comfortable with the 21st?
I am.
Yes, I am.
Sure. Eric?
Charlie,
I believe I will be out of town. I don't have it in this calendar. I have to check another calendar. I can get back to you on that.
Tentatively?
Yeah,
Sure.
if that works.
we might have another member by then anyway,
Okay.
possibly. I don't know
Yep.
how fast the Board of Select Board would.
Okay.
What's that? You won't be here.
You won't be here? Oh,
Okay.
oh, you love the 21st then, don't you?
Vacation denied. Absolutely, go and enjoy. Hope you're doing something fun. So tentatively, the 21st of August would work. Charlie, is that, okay, we're going to put that down. And then as we move to the fall, make it back on a regular calendar. And certainly if something comes up before the 21st,
Right.
I'd give you ample notice, and we'll put that out.
Okay.
Anyone?
I move to adjourn?
Second?
Right. Eric, you're third.
Yeah, you're third.
Stay with us now. Okay. Let's
All in
skip the
favor?
discussion. All in favor of the motion, just raise your hand, say aye. Aye. Meeting is
Aye.
adjourned. Thank you, everyone.
Excellent.